So the Prospective Urban-Rural Epidemiology Study, or PURE, is an ongoing prospective cohort study that includes many participants of middle age, between 35 and 70 years, from countries of high, middle and low income around the globe. This particular analysis that we'll be presenting at the meeting includes 160,000 of the participants who've now been followed up for a median of over 9 years. What we sought to do was understand the reasons behind why people die, the causes of what they die from, as well as patterns of disease and hospitalizations and other patterns of utilizations of medical resources. Our major findings were severalfold. Firstly, non-communicable disease is the most common cause of death amongst the countries studied. Secondly, we found that within non-communicable disease, there appears to be a shift. Whereas cardiovascular disease is the most common cause of death in low-income countries, as we move from low-income to middle-income countries, the proportion of deaths due to cancer is increasing. And in fact, in high-income countries and some upper-middle-income countries in our study, we found that cancer deaths now account for more deaths than cardiovascular disease. And this has important implications, we feel, for healthcare resources and where the focus of attention should be. So specifically, we found that in wealthy countries, one was on average twice as likely to die from cancer as from cardiovascular disease, whereas in low-income countries, you're about 3 times more likely to die from cardiovascular disease as opposed to cancer. Another important finding from the PURE study was that there was an inverse relationship between various indicators of access to healthcare and outcomes. So for example, countries where hospitalizations were more frequent and countries where cardiovascular medication use was more frequent were associated with lower risks of mortality. And so we feel that access to healthcare in all countries, but especially in lower income countries, is a particularly important step that needs to be taken to reduce the burden of cardiovascular death worldwide.